Hi, my name is Daniel Salinas, and this is my elbow eval video. So, hello, Mr. Osterbach. What brings you today?
I've been having this really bad pain on the inside of my left arm.
Okay, what sport do you play again?
Golf.
Play golf? Okay. How frequently have you been playing golf lately?
So we're in the middle of a tournament, and today's the last day, so I really, got to be out there. But okay. This started 2 days ago, so today's day 4. Started 2 days ago. Yesterday I just kind of played through it, but it's getting a little bit worse today.
Okay. Has this happened to you before at all?
Yeah, I got diagnosed once with medial epicondylitis before, so I mean it's kind of happened, but today's a little bit different. So it kind of hurts and kind of those little numbness and tingling down my arm. Okay. So that's different from before.
Okay. So what makes it feel better or worse so far, just in your daily routine? How about that?
Better is just not using it. I guess if I'm not using it, it's fine. But
okay. Do you feel pain when you're basically gripping anything, or actually, even better question, when you're golfing, when do you feel your pain?
So when I'm golfing, it hurts most at the end of my swing.
At the end of your swing? Okay. Yeah. And are you right-handed?
Yeah, I'm right-handed.
So you're right-handed, so you're going through, coming across, and you're feeling pain on the inside, you're saying?
Yeah.
Okay. Okay, good. Okay, so then can you describe the pain for me? And you said numbness, but it was fairly sharp.
I mean, it's an achy pain. It's a deep, dull, achy pain.
Right.
But it's fairly intense. So.
Okay. And on a, let's say, pain scale, tell me the worst pain you felt. 0 being nothing, 1 being barely anything at all. What would you rate it at when you first started feeling it yesterday? You were saying a few days ago.
It was like a 4 or 5.
Okay.
So bad, but not the worst in the world.
Okay. And while you're sitting here at rest, what would you rate it at?
Right now it's fine. It's like a 1, I guess. I kind of feel, but it's not really.
Okay. And you said that you heard it 2 days ago.
Yes.
Okay. And okay, so with the history that's taken, I would suggest thinking that it is possible medial epicondylalgia. There could be possible fractures, or even a strain of the flexors in more of the belly of the muscle, or any nerve pathology, injury, and stuff because of the numbness that he was saying he felt. So with that, I'm doing my observation a little bit just to kind of take a look. So is there any swelling, discoloration, or any deformities here? Any swelling at all in this area?
There's a little bit of swelling.
Okay. And is there any bruising at all?
No.
Okay. And any very obvious forms of size of swelling? Is there anything kind of weird? No? Okay, great. Okay, so then we're going to look at another one is carrying angle. So when they stand, particularly where the angle between their lateral side of their body and where the forearm is extended will determine kind of a nerve where it's at, but I would imagine that it looks fairly normal. Okay, good. After that, I will do my palpations. I'll start with boning. So then I'm going to start at the humerus. So we're going to kind of squeeze in there. Have any pain particularly? No. Going to feel the structures of the medial here and the lateral epicondyles. Any pain on the lateral side at all? Out here? No?
That's fine.
On the inside here, do you have some pain?
It's a little tender.
A little tender, okay. Anything back here, alephronome process?
No.
No? Okay, I'm just going to go down your arm. I'm going to find your radial head, or just a radius. Any pain in there?
No.
No? And we're going to find the ulna and palpate that as well. Any pain? Okay.
No.
Okay, great. Then we'll do soft tissue. So we will start with kind of just palpating generally the forearm. So we're looking at certain muscles like the palmaris longus, flexor carpi, ulnaris, radialis, stuff like that. Any pain necessarily down here at all? No. Anything on this inside?
It's a little tender when you start.
More up here?
Yeah.
Okay, so where the origin of the flexors originates from is the medial epicondyle, so you'll have pain there with anything like epicondylomalacia. So. And then anything up here just to kind of get no biceps tendon, nothing in here at all on the inside, no biceps tendon, any injuries there. Outside we'll go wrist extensors. Any pain?
No.
Good. Okay, great. So then we'll go through ranges of motion. So I'm gonna have you do both actually. So we're gonna go here. Can you bring your wrists up here? So wrist flexion. Any pain?
A little uncomfortable.
A little uncomfortable there? Okay, great. So then now we're gonna go down, wrist extension?
No.
No? Okay. So I'm gonna have you kind of turn your wrist out for me, okay? Any pain there?
No.
Not really. And then going in? Good. Any pain, just bend your elbows? Elbow flexion? No?
No.
Going all the way
Not
out?
really.
All the way out? Extension? No? Good. Okay, so then after that, I will do passive, so I'll just do the injured side for now. Any pain when I go back?
No.
Okay. Any pain when I go up?
No.
Pain going radial deviation? No. Ulnar deviation? No. Okay, and then good. So now I'm going to move you through. Oh, sorry. Forgot one for active range of motion. So can you turn your wrist in? Kind of turn it down. Okay. Any pain?
No.
Going out? Any pain? Good. So that's pronation and supination. So now I'm going to do passive, kind of going out. Feel any pain? Supination, pronation? No? Okay. Now I'm going to go through resistive range of motion. So kind of make a fist again. And I'm going to have you just basically curl your wrist. So any pain with that?
Yeah.
Okay. You felt pain
Yeah,
here?
up here.
Okay. And then I'll have you turn your wrist. Now I want to bring your wrist up. Any pain?
No.
Okay. And then bring your wrist up. Any pain?
No.
And then just bring your wrist that direction. Go ahead. Any pain?
No.
Good. So had pain with wrist flexion, so still thinking medial epicondylomalacia or any wrist flexor strains. But since he didn't have necessarily pain with wrist extension, kind of extending the flexors, you have any pain, kind of makes me think it's not a muscle strain. So we're going to move on from there, and we're going to do valgus and varus stress tests to see any ulnar collateral ligaments or radial collateral ligaments of the elbow. So try to relax. And any pain with that?
No.
Good. And then any pain with that?
No.
No? Okay, great. And then I'm going to have, that's basically my stress test, special test for those ones, because I'm starting to really focus on the medial side, and if he doesn't have any ligament tears, he would have pain there, or any laxity, and he felt pretty strong and steady there. So we're going to go into my differential diagnosis at this point, and any diagnosis that I have. So he didn't have any fractures with palpation, so that's out. Wrist flexors, he didn't have any pain with wrist extension. He had some with resistive range of motion of wrist flexion, but it was more at the origin of the wrist flexors. So still thinking now my diagnosis is going to be medial epicondylomalacia or golfer's elbow. So then my plan for that would be to basically put in like a splint, so like a wrist splint just to resist flexion or extension. They usually wear it at night if they have any pain, so it'll kind of relieve it, take some pressure off at the medial epicondyle insertion or origin. You can do a kind of like a compression band around the wrist to also relieve the pressure, and usually as a daily thing. Or eventually, if they need to, they can get surgery, but they don't necessarily need it. You can relieve the symptoms, lessen the pain with those treatments. We'd do treatment. We'd come in and have you do rehab, work on all three of your ranges of motion, get your strength, keep it strong, but also really focus on reducing the pain. So using ice treatment, we'll do interferential currents, we'll do ultrasound, stuff like that. And then we'll work on changing his skill technique to make sure he's not overextending and really focusing on dispersing his energy through his swing. But that's basically it. That's my video.